I'm John Rizzo. I'm VP of the Akron-Canton Advocacy Alliance, which is a collaboration of the Greater Akron Chamber and the Canton Regional Chamber to represent the needs of our nearly 5,000 members in front of elected officials and policymakers. And in this role, I have the very distinct pleasure of talking with many of our members on a regular basis about various key issues facing the business community. And today's topic is very much aligned with many of those conversations. In recent years, addressing issues related to access, affordability, and quality of childcare has emerged as both an economic and a workforce development imperative. What we've heard from businesses pretty consistently is that childcare is, simply put, no longer a family issue operating in the background of an employee's personal life. It's a core component of developing and maintaining their workforce. When working parents can't find reliable, affordable care, employers feel that impact through absenteeism, reduced productivity, higher turnover, just talent issues more or less across the board. So conversations with stakeholders in recent years have really began to position childcare as infrastructure, pointing out its importance to economic growth alongside other priorities like transportation or even broadband. So as lawmakers in Columbus and DC continue working on solutions that address the various and complex issues associated with improving childcare systems, we're going to focus on one specific program recently created in Ohio's latest state operating budget, the Child Care Cred Program. So with us to discuss that program is Joel Potts. He is the Department of Children and Youth's Chief Government and External Affairs Officer. And before I pass things over to Mr. Potts, I just want to encourage anyone with questions to either enter them into the chat or at the very least hold them until the end of the presentation. And to please keep yourself on mute for the benefit of those listening in. So without any further ado at this time, Mr. Potts, welcome to the webinar. Thanks for being with us. The floor is yours.
All right. Hey, thanks, John. Thanks, all of you. I appreciate your participation today. And I really appreciate John's patience and tenacity. We've been wanting to set this up for a couple of months. Really appreciate the interest of the Alliance. I have been speaking with chamber groups all across the state. This issue is becoming more and more, I think, important. When we talk about the economic viability of the state and strengthening our workforce. So I really welcome the opportunity to talk about not just the Child Care Cred Program, but just childcare in general and how it is impacting the state, and kind of just give you kind of the idea of what the state of things are, in the childcare world. So first of all, I just want to talk a few moments about who is the Department of Children and Youth. If you haven't heard of us before, you're probably not alone. We are a new state agency that was created a little over 2 years ago. We officially became a department last year. The Department of Children and Youth is an agency that's focused on promoting positive, lifelong outcomes for kids. So the governor decided that he wanted to have a department that was solely focused on kids from pre-birth all the way up through age 21, and try to get programs working more succinctly together. So they brought in programs from 5 different state departments, brought them under one umbrella to become the Department of Children and Youth. So it's not that those departments weren't doing well, and those departments still exist, but we took staff and folks from and programs from those various things, over 60 different programs that are kid-focused, where they can work together to help us achieve better outcomes for kids. It is not JFS or Job and Family Services 2.0. These are not poverty programs, while some of them do have eligibility, depending on what the programs are, that focus on various incomes. Our goal is to provide resources and services to kids regardless of income, regardless of where they are in the state, regardless of what their needs are, and have those things work together. One of the cornerstones for us is that we are determined to try to focus on things when they are a question and not a crisis. I've been working in government for well over 40 years, and I think that's one of the real challenges, is that government is often just too reactive. We wait until the problem or the crisis occurs before we really get involved in the issues, and we want to make sure it's not happening. We want to be data-driven. Identify what our goals are, look at what we're trying to achieve, measure it, see if we're getting there or not. If we're not making it, then we know we need to make changes. And if things are working, we want to see what's working and how do we make it better. But too often, we don't ask those second questions. And we really have spent a lot of time letting the data really kind of drive the conversations. And it's been a little different, to be honest with you, within the bureaucracies. As I said, I've been around in one capacity or another for several decades, and it is different. I use the example often that there's a huge difference between knowledge and wisdom. Knowledge tells us that tomato is a fruit, but wisdom will tell you you don't put a tomato in a fruit salad. It's kind of the same thing, when we look at, do we really know what the program is, or what have we learned from it? I had an experience, I don't know, more than a decade ago. I was representing county job and family service agencies, and I had a phone call from somebody at one of the state departments. We had a program that's referred to as NET, or it still exists. It's non-emergency medical transportation. It's helping individuals get to doctor appointments, chemo, treatments, various different services that don't require an ambulance, but they do require help getting them to and from doctor appointments and to address their medical needs. So the NET program is operated through the county job and family service agencies. So one day I get a phone call, and the individual says, "Hey, Joel, I just want you to know we're about to take the non-emergency medical transportation program away from the counties because of we're seeing a lot of abuse, and we're going to take it away, and it's going to become a state program." Now, I'd heard over the years lots of challenges within that program, but I never heard the word abuse, and that really stuck out. I said, "Well, can you give me an example?" I said, "I've never heard of abuse. What do you see is going on, or what's the problem?" And they said, "Well, we're just looking at the data over the last several years in Gallia County, which is southern Ohio, right on the Ohio River, one of our absolute smallest counties, is spending almost $2 million a year on net, whereas Franklin County is our largest service county, and they're spending less than $1 million a year on net. So we don't know what's going on, but obviously something is really fouled up, and so we're taking it away." And I said, "Well, before you do that, let me make a couple phone calls." So we got off the phone. I immediately called Gallia County, asked the director, I said, "Hey, why are your net costs so high?" And he was like, "Well, it's because we're in the middle and we're at ground zero for the opioid crisis. And the number one treatment at that time was Suboxone." And he said, "There are zero Suboxone clinics in all of Appalachia." So Gallia County is responsible for getting individuals that have addictions that often through the courts are ordered, to get Suboxone. So they are taking individuals all over the entire state, literally as far away as Toledo and Youngstown, to find individuals that could provide the Suboxone treatment. So they would pick the individual up. They would drive them for hours, take them to the Suboxone clinic. They'd go check in, get the medication, come back out, get in the car. They'd drive them home and say, "All right, we'll see you tomorrow," because Suboxone is a requirement that you do it every single day. So it was bad for a host of reasons, but from the idea of just government, I just always found that example is something that says, we're really not looking at what that information is telling us. If they had just asked the one question, what that data was telling us is that we need Suboxone clinics in Southern Ohio and Appalachia. Wasn't telling us that there was anything fraud or nefarious. Franklin County, by the way, also has public transit, and they had a host of Suboxone clinics that were able to provide to the community in the Franklin County area. So, there's a difference. The knowledge said something is askew, but they never asked that next question. What we're trying to do as Partner Children and Youth is ask that next question and see what the data can tell us, and how do we improve programs, and how do we make sure that the investments that taxpayers make into our programs are actually working. So as John had said, I'm the Government External Affairs Officer, which usually by the time you get a title and you get your business cards made up, it changes again. But what it basically means is I do a lot of the public presentations. I do our legislative work, our government work, and I get the pleasure and honor of working with groups like the local chambers. So I want to go through, talk a little bit just about the background of child care here in Ohio, talk about the Child Care Cred Program, how it operates, who's eligible for it, how to apply, and I'm happy to answer any questions that you may have. But just to give you a little bit of a background on affordable childcare. We know that accessible, affordable childcare is necessary to support the workforce to provide economic viability for children, families, and the state of Ohio. We've actually done two recent surveys now over the past almost year Well, we have surveyed thousands of working parents who are in the childcare field, and consistently these surveys have come out to show that 44% of the parents are saying they've had to miss work, leave early, or lose focus at work because of challenges with childcare. 49% have said that they've had to cut back their work hours to care for their kids, and a full 61% of mothers with children 5 years and younger who are not currently working full time say they would return to the workforce if they had, or work more hours, if they had access to affordable childcare. I mean, that's over 61%. And both those surveys showed that almost two-thirds of parents are saying they'd work more hours to return to the workforce. One of the big questions we had after COVID was, where are the workers? This is part of that answer, especially when you're talking about specifically young families, that 20 to 30, 35-year-olds with young kids trying to figure out how they're going to meet all the challenges in the childcare world. On average in the state of Ohio, it costs $11,000 per year for infant care and child care. I have one employee here who's spending $18,000 a year for her infant in care. To put that into perspective, it's $11,000 for an infant care. It is $13,000 is the average in-state tuition for state universities here in Ohio. You can get a loan for a state university to send a kid to college, but there aren't loans, to help parents get through, those child care costs. A family with two kids in child care are spending in excess of $20,000 per year on average in Ohio. For two-parent incomes, they're averaging about 10% of their income goes to support childcare. For single parent households, on average, they're spending 39%. It is the single largest cost generally for working single parent families. So more than their mortgage or their rent, their housing, and those sorts of things. So we know it's a real challenge. On average, a family with two kids in care are spending approximately $11 an hour for childcare. So before that parent spends one penny on transportation, food, clothing, their own housing, any of the work expenses, transport, any other expense. First $11 they make each hour is generally going to childcare if they've got young kids in care. So I am very, very appreciative and appreciative of the Alliance for allowing me to have the opportunity to talk to you all today. Also been really just really pleased with the great work that's being done with the state chamber and the national chamber looking at this topic nationally. Last April, they released, the National Chamber of Commerce released a survey. It said in Ohio that they have identified that we lose over $5 billion a year. In fact, it said $5.6 billion a year is lost to productivity in Ohio each year due to child care issues. And that is a loss in tax revenues of approximately $1.7 billion. So we know that child care is impacting the workforce, it's impacting families, it's impacting you, and we want to look at ways that we can address those types of things. I'm going to talk about poverty levels in a few minutes, and I always hate getting into the minutia of bureaucracies and government. But there are multiple child care programs that are available. And I just want to make clear that we're going to be focusing on the parent expense when the parent's paying for all of their child care. But if you are under 200% of poverty, there are programs that are available. There's early childhood or public preschool programs. There's Child Care Choice Voucher, and I'll explain what all these are. And then there's publicly funded child care. But there are programs that are available to provide child care for younger families, but we're going to focus the Child Care Cred Program on those making over 200% of poverty in ways that we can help address some of those child care needs. Many of you have heard of the benefit bridge or benefit cliff, and we've talked about the challenges that families, they don't want to work more hours or take a raise because it can negatively impact their benefits. I just want to walk a minute through this scenario, which is unfortunately, all too typical scenario that families often face when they enter the workforce if they've got kids in need of childcare. So this is a family of four, two adults, two children. Both children need childcare. One of the family members is in school full-time. The other is working. So we're going to focus on Matt, who's the worker. He would be offered or could get a job at $40 an hour or 40 hours a week at $21.50 an hour. He would need childcare, but he would be over he would be over the income levels. And again, I'll get into those here in a couple of minutes. But he would be over. So He would be over by a mere $73, but he would not be eligible for any of the government programs. And his monthly, so he would have to find childcare on his own. His monthly income would be $3,698. He's able to find childcare, and it's costing him $9.62 an hour. So his monthly cost for childcare would be $1,668, or his take-home pay now, from the monthly gross down to his take-home would be $2,030. So as you can see, if he's paying his own child care, a good chunk of it is already going to be gone before he has any other bills to pay. So he realizes that. The family realizes they can't afford private child care, housing, transportation, food. So he considers a job, a different job, which pays $21 an hour, 50 cents an hour less. So his monthly income, it should say instead of cost, his monthly income would be $3,612, but he's now eligible for child care, government subsidized child care. His copay drops down to $316 a month. His take-home pay is significantly increased to $3,226. Or Matt could decide to take a job working 30 hours a week instead of 40, and at $25 an hour, he would be eligible for child care at that rate. His monthly gross would go down a little bit. His copay is less, but his take-home pay is better. So I go through all that to say is, this frankly is wrong. A job should always be a better option. We shouldn't be competing with the workforce. We need to be supporting the workforce. Our goal and intent should always be for individuals to increase their earnings, to be in a better position to care for their kids, more productive, with their families, more productive in society. And we really want to address those types of things. So when we talk about the benefit bridge, that's it. This individual would be at the top of that bridge. So there are some things that we have done here in the last couple of years since the Department of Children and Youth began. We do now have a voucher program in Child Care Choice. So in this individual's case, they would be eligible for a voucher. They would have a copay that they would be required to pay, but it would be in line with everything else, and they'd be able to continue in the workforce and increase their earnings. But our goal ultimately is we want to make work pay. As I said, a job should always be a better option. And we want to make sure that our programs complement and don't compete with each other. And we definitely don't want to be competing with work. We want to be supporting work, because I think that is ultimately the best poverty reduction program is through employment. And we want to help individuals be employed. So the goal of the child. Yes.
Sorry, Director. Steve Miller at the Greater Akron Chamber. First, thanks for doing this today. But I had a question for you about that. I know that in Summit County, we've played around a little bit with some programs that sort of create a little bit more of a smoothing of the benefit cliff. Yep. To sort of help folks do this. But as an employer, I have had the experience of having somebody refuse a raise because it would take them out of benefits. And then ironically, it also reduces the amount of dollars the state gets from taxes from those people being employed as well. So is that becoming more and more common across counties, finding ways to do that? Or have you seen them having success with some of those programs? Just would love the broader experience that you may have seen there.
Great. No, thanks for the question. And actually, yeah, everybody's been talking. I think this has been probably the last half dozen years. This has been something that local areas have been trying to address. I think it is to the great work that the chambers are doing to say, hey, we're seeing more and more of this. When you've got workers who are simply saying, hey, I'm going to turn down a raise, or I'm going to work less hours, there's clearly something wrong with our systems. They need to do more to either step down or make transitional benefits or help people make those types of movements. But yeah, there are a lot of efforts that are going in. Summit County has actually been more involved than most. They've received some additional state and federal funds, in fact, to even support some of their benefit bridge projects. And they are finding real success. And generally, when they have individuals that would be, if you use this scenario, they also provide what is really, really important, which is financial management courses that go with it. It's usually a requirement, so they're not just handing out money, because if they provide that support, there's always going to be, a point where individuals are no longer going to be eligible for all of those government support programs. But there are ways to make that transition, to make it easier and make it better. And what we are finding from these local programs are various ideas and various ways that they can address those. Usually the ones that work best, Summit County is one of those that's been heavily engaged in this, are those who do actually provide case management and they work with these individuals. So it's not the individual just being on their own that are suddenly thrust into trying to figure out. This is just childcare. There are other programs that they may be involved in. They may want to try to get better housing options and address healthcare issues and getting into um, jobs and making sure that they've got the kind of health care that their family needs. If they've got pre-existing conditions, sometimes they need certain doctors or certain types of medicines and things to be covered. So there are just so many issues that are there. So these benefit bridge projects have become more and more prevalent. But at this point, they are still much more locally driven and what the locals are able to pull together. The State Department of Job and Family Services supports those benefit bridge projects. They've got, I believe, 10 or 12 of them. They are operating around the state, and I believe Summit is the largest county that's doing it, but I'm not positive on that. I'd have to check with Job and Family Services.
Thank you.
Oh, thank you. So our goals of this Child Care Cred program, and we'll get into it here in a moment. I know I talked a lot. I apologize. We'll get to this quickly. But we want to increase employee attendance, productivity, and reduce turnover rates for businesses. That's one of the things when we're talking to the chambers, when we're talking to the state chamber, they're hearing a lot from businesses that, just the turnover rate is very expensive, and they know that they've got childcare concerns. At the same time, we also, when we can, we want to enhance access to high quality childcare for working families. You're going to hear that term quality when you're talking childcare a lot. What that really means is not just childcare, but it provides education supports. It helps kids in their educational pursuits. We always talk about a two-generation approach. We want to support the families, but we want to support the parents who need childcare. They need a safe, reliable place for their child so that they can go to work. But we also want to utilize those opportunities wherever we can to make sure that kids are receiving those helps in school. We do know that kids that are in education settings for childcare, everything consistently shows they will do better in school. They're less likely to be dropouts. They are less likely to be teen parents. They're more likely to graduate and attend college, and they will have increased earnings over their lifetime. So if we can utilize these programs to support both those causes, we're helping not just the workforce of today, but hopefully the workforce of tomorrow. And then obviously we want to increase financial stability for families and lower turnover rates for the child care. We say child education programs, but what we really mean is just the child care provider community. They're out there really struggling too, because when you've got families that are moving from job to job and their incomes are varying, and what kind of supports they get will determine where they send their kids for childcare. And childcare providers have to have staff availability. There are ratios that they have to meet. There are health and safety issues and things they have to meet. Their costs are pretty high. So the more consistent we can have families, not just in the workforce, but have consistency with their kids in the level of care, it's going to help ensure that we have childcare facilities and childcare operations in your community, so that when you hire an employee, there is some place for them to send their kids. So to that, we've got the Child Care Cred Program. It is a new program. It was put in our budget. It is designed to help working families afford childcare by sharing costs. It focuses, and again, I'll get into these numbers here shortly, focuses on families whose household income are between 200 and 400% of the federal poverty level, and that would depend on how many kids. Employers are not required to participate in the child care program, but can opt in, and it is very, very flexible on what that opt-in would look like, who you would want to serve. We have some individuals who are looking at utilizing child care program for jobs that they have a hard time recruiting for, or where they have a high turnover rate, or maybe it's a situation where they need second shift, third shift, and those sorts of things, and it's hard to attract individuals who have young kids. So they've looked at whether or not they want to utilize childcare as a benefit that may help parents to make those decisions and bring them into the workforce. So For partners, employers, it requires work at the local level as far as identifying who would be in the program, but it is for employers, employees, and child care programs or child care providers would be working together in order to make this program happen. So families who are eligible for Child Care Choice Voucher Program, early childhood education, publicly funded child care, which is subsidized child care through the state of Ohio, are not eligible for the program. The reason they're not eligible is because those individuals would already be eligible for these programs. There would be no reason for the employer or the child care centers to be put additional resources or dollars into their care. So the eligibility requirements are for, hang on, I wanted to go back. Sorry. Sorry. Just had a note. I thought I'd said this and I hadn't. The messenger matters. And what we have really found is that people are hesitant to come to government for help. They are very hesitant to come to Job and Family Services, Department of Children and Youth, and things, because they view these programs as poverty programs. They view our programs as welfare. And while those programs are important and do provide important supports, these are clearly work supports. You know, you must be, in order to be eligible for child care in any of our programs, you must be employed or be in school full-time in need of educational services to be eligible to have child care. So what we found is that families will listen to their employer for saying, hey, we've got this program and we'd like for you to be in it. We sign up. One of our lessons learned is that many of the families that are signing up for the child care program are ineligible for child care cred because they're already eligible for other child care subsidies. So in those instances, what has happened is those families are able, they can do it online. They don't have to show up at a government agency, but we can get them signed up for child care. They're eligible to receive child care, and again, it doesn't cost the employer anything except the direction. But that direction is really important. We've seen it in program after program, working with business after business and chamber after chamber, that messenger really is important. That we saw the same thing when it came to the Affordable Care Act when it was passed with healthcare. You know, there are a lot of individuals when they say, "Are you on Medicaid?" It's like, "Oh no, I'm in the exchange. I'm on the I'm getting my benefits through the Affordable Care Act." But in truth, it was Medicaid. That was just the payer. They saw the benefit as very, very different. When they saw it as a work support, they went for it. When they saw it as Medicaid, they weren't doing it. Child care is kind of the same thing, you know. And we even use, when we throw out 200% of poverty, 400% of poverty, truth be told, that's a bureaucratic term. Nobody really knows what level of poverty they're living at or what level they're paying. And it makes it challenging when individuals come into these systems. You know, when you say, well, what level of poverty you're at, it's like, I don't know. I mean, we've all most likely had hourly jobs when we were growing up, or maybe still do. And I say that to me is one of the real telling factors. If you were to talk to somebody and ask a salaried employee how much they may say, oh, I make $60,000 a year. I make $72,000 a year. I make $30,000 a year. Ask somebody who's working hourly, how much do you make? And they'll say, oh, I make $14.60 an hour. And you'll say, well, how much is that a year? And they're going to look at it like, how the heck would I know that? Hourly workers tend to have fluctuating incomes. They pick up a shift, lose a shift, whatever the case may be, and it can have a big difference in what their take-home pay is for that pay period, you know, or over the year. So we talk about those levels of poverty, but people really don't know what they are. So if we can get them to sign up for child care, regardless of which door they come through, I think the families are going to be better off and the businesses are going to be better off, because a lot of our services are out there, are available, and families haven't signed up for them. So the eligibility requirements, and I'll get into this in the next slide, as far as they have to have incomes between the 200 and 400% of poverty based on their family size. Employers must be based in Ohio. Now, there are some national employers, as long as you have an Ohio presence, you would be eligible, for this. And the programs must be a child care center, preschool, or school-age child program. So that to me is just kind of bureaucratic mumbo jumbo. We license facilities; they have to be at a licensed facility. They do health and safety checks and already have billing and set up and things. So businesses would not have to get involved with that. So we're talking about poverty levels. This is an unfortunate reality, that comes with government programs. There is almost always going to be some type of eligibility that's going to be tied to it. It's rare that you're going to find them that aren't. But we are focusing on jobs that are over 200% because there are child care programs that are available for those under 200%. So for a family of three, which is kind of our average, that would be for individuals making between $53,000 a year, which is about $25.60 an hour, or a maximum for that family of three of about $106,000 or $51 an hour. So individuals that are in those price ranges would be eligible for the child care program. Now, again, if they're making less than that, they would be eligible for other programs. But I do feel good about these programs. One of the reasons I really like the child care cred approach and various approaches to finding solutions, for better paying jobs is at this level, government's not just supporting jobs, we're supporting careers. When individuals start making these kind of dollars, they're going to be in a much better position to take care of their family. They're going to see the benefit, of work, and be much less likely to go backward, onto public assistance programs and those sorts of things. So, I like that we are supporting those jobs. If we're supporting jobs that are all at the $15, an hour range, families who are in those situations really don't see big benefits, to their commitment to the workforce. They're making $15 an hour at this facility. They know if they lose that job or leave, they can go make $15 somewhere else. Today doesn't look any different than yesterday, and tomorrow's not going to look any different than today. But when we get them into jobs that are better paying, they're going to see benefits in lots of ways, including their incomes and their ability to care for their families. So application is really pretty straightforward. John had said, you'll have these. There are links in here to pull up. The application is pretty straightforward. We've tried to make it as easy as possible. Once we review the application, we'll look to make sure those applicants meet the eligibility requirements. So we have had about 40% of the families that have applied have been ineligible for Child Care Cred because they are eligible for other child care programs. That's good news for the family because their copays will be less. It's good news for the employer because it doesn't cost anything, but it does link the families to the same kind of child care, the same types of providers, the same services that they would receive through Child Care Cred, but government would be paying, for the whole piece. And once they are eligible, they'll remain eligible for the program. They don't have to reapply and keep going through those types of things. So we're often asked, do these programs work? One of the programs that actually has been doing this on their own is the Alliance Employment Promise Program from your area outside of Canton. I'd spoken with them just a couple of weeks ago, and they're serving currently 74 families, 108 youth through that. And they've got some businesses that are reporting that they have had a 100% retention for families that have been receiving child care support and child care services. We're looking at other states that are doing these types of programs. They refer to them often as tri-share programs, and they're also reporting that it has done a lot to really help stabilize their field. So we're hoping to see the same types of things here. So the goals of the program are obviously to make child care more affordable by splitting the monthly payment costs between participating employees, employers, and the state. It allows employers to attract and retain talent. It assists employees with child care costs, and it sustains child care businesses in your community. The program itself was set up by the state legislature. It is again, a tri-share model, which has employers paying 40%, employees paying 40% of their child care costs, and the state paying 20%. So once somebody is approved, that child would be going to a child care center. That child care center would bill each month. So if it costs $1,000, they would bill the family $400. They would bill the employer $400. They would bill the state $200 to make those. It is established in statute. And I would say we believe very strongly in partnering children to safe, affordable, reliable child care is not just a luxury. And it is a key component of economic development and family well-being. We know that when families have access to childcare, they can work more, build financial security for the families, and contribute to a stronger economy. You know, we in the Child Care Cred Program, um, applications need to be submitted, and the link is there by May 1st of 2026. That's not a lot of time. The way that the bill was set, the legislation was set up, it was to be a one-year program. We are very actively engaged with the state chamber and engaged with the legislature, hoping, and I feel relatively confident that they're going to extend it for another year to be able to utilize those dollars, which would extend that. If we can get the one-year extension, it would mean it will be up through May of 2027 for people to come into the program. We have lots of different approaches that people are considering. The interest has been off the charts. I haven't seen anything at the Department of Children and Youth that has had this kind of interest. Especially, you know, as I said, well, I've heard from tons of local chambers or tons of local businesses that are interested in this. But one of the things that has really, held folks back is that May 1st deadline. The other thing that has held them back is they're looking to see, give me some good examples, so we're trying to identify businesses that are doing it. Well, not trying, we are finding those businesses, and then we can help refer you if you want to talk to some of them about how they're doing it. We currently have 34 approved programs in the state. Businesses that are operating include medical offices, child care providers, product sales, and churches. So little different as far as how they're all approaching it. I often hear questions, well, how do you decide who in your business is going to receive these services, and how do you ensure equity? If you've got a family who has a need for childcare and you're providing a benefit to them, but now you're not providing a benefit to somebody who doesn't have childcare. Those are things you're going to have to decide. Do you want to do it as a recruitment tool? Do you want to do it as a retention tool? You may want to say, hey, if you are here, stay for a year, we'll help offset your childcare costs. Or if you come on board, we'll help you pay your childcare costs for the first 3 months. It really is very open-ended for the business to decide how they would want to do it and which populations they would want to be able to serve. So we do know that investing in childcare help strengthen your personal workforce. We know that when employees struggle, to find reliable childcare, your business feels it. You're going to see higher absenteeism and tardiness. You're going to see lower productivity and morale, and you're going to see increased turnover and high replacement costs. And on average, turnover costs average about 33% of an annual employee salary. So if you're replacing one $45,000 employee, what we're seeing is that it can cost up to $15,000 in recruitment, overtime, and training expenses to get somebody else into that job, to get them trained, to get them ready to be able to functioning. So we want to do what we can to support you to help make sure that that turnover slows down, that families are supported, that your workforce is as strong as it can possibly be. It's better for the families, it's better for the employer, it's better for our communities, and that's what we're trying to accomplish with Child Care Cred. So with that, I am happy to take a breath and answer any questions that you may have.
Joel, thanks again for doing this. Super informative, and there's many on this call, and I know through the statewide business community, the Ohio Metro Chambers Coalition, there's lots of advocates wanting to see this extended, as well as some of the other programs that are being discussed, funded and implemented. But there are a few questions. First, one just came through the chat. Does the funding cycle ends means the payments will only last until June 30th?
Yes, for bills incurred up through June 30th. So we would pay it beyond that. But yes. So it would pay for childcare up through June 30th without a change in statute.
Right. And then you mentioned that eligibility lasts, that folks don't need to reapply, but is there a certain time period? Let's say this gets extended. Is there a certain time period
if it gets
or
extended,
a change in circumstance cause a recertification?
Good question. Because we haven't dealt with it before, I'm making an assumption, and we all know what we say about assuming, but it would be at least for a year, if not for the life of the contract. So, or the life of the program. So the program was created by a 2-year budget cycle and what they refer to as temporary law, which means that it would need to be renewed, in the next 2-year budget cycle. So, um, I, I'm very confident that it would be at least a 1 year before they would have to reapply. But because of the uniqueness and where we are in the process, it may be for the life of um, the first iteration of Child Care Cred. The legislature really wants to see this work. The interest in the legislature is off the charts. They really want to see something. They know that the costs just keep going up. They're trying to come up with ideas and ways that we can start containing those costs and really kind of addressing those issues. And they don't want to put it all on the employee. They don't want to put it all on the businesses. They are very interested in the legislature helping to provide that support. They see the value of this. So I think it's relatively open-ended, but like I said, as long as we can get the extension, I would assume at least a year.
Well, and putting our political hats on, they set this up as a pilot. Do you feel in your engagements with legislators that, they feel like there's a real desire or motivation to make this a more permanent program?
I absolutely. I've both sides of the aisle, both House and Senate, I have had lengthy conversations with members who really love, and everybody calls it TriShare. There is actually a TriShare program that started out in Michigan that is around various states. In fact, I think every state that surrounds us has a TriShare model. This is Ohio's version of a TriShare model. But I've had lots of conversations, and there is a lot of interest in seeing this work.
Another question from in the chat: does an employer have to partner up with the child care provider of their choice before applying, or can they get matched up with providers in their vicinity?
They can get matched up. And if you need help with that, let us know. But yeah, if they've got it's the employee ultimately is going to want to pick their child care, so it's got to be a license. We would provide you with a list of providers that are in the community. It's online as well. You can type in, Stark County or Summit County and, providers that are here. It would identify all those licensed providers. And the employee would need to go there and make sure that someplace they feel safe, it meets their convenience. There are so many different factors that comes into it, depending on how many kids they have. Some of them may be school aged and they need before and after school care. Some of them may be infant care, which is harder to find, and they want to be comfortable, obviously, with where they're going to be, and comfortable leaving their kids there. So, if employers needed help trying to having that employee find that, what we generally are seeing is it's the other way around. They tell the employee, hey, we're willing to do this and provide that support, but let the employee go find that child care, because those are just personal decisions that the families are going to make. So they would come back and they would have to identify who. So the application itself is going to identify. You have to identify who is the employee. And who is the child care provider, and they would have to sign it. So it would have to be decided before the application for each of those individuals. The application is really straightforward for a government application, but that is definitely one of the bigger challenges. But for the most part, that challenge, if the employer is willing to do it, it is. Something that's going to have to be worked out with the family and the child care providers. It's just something that's going to have to happen.
There's a question in here about the total budget. I believe it's 10 million. So you could correct me if I'm wrong on that, but maybe taking that question and building on it, as you're talking about extensions and, the support and enthusiasm from the legislature, does DCY have in its head a dollar amount that it would like to see apply to this program over a longer period of time based on need and subscription?
Yeah, it's a good question. The legislature put 10 million in it, having absolutely no idea, and I don't mean that in a bad way at all. It's like we don't know what a right amount is, but we want to see that. We will not come close. We will not come close to spending that in the first year, which is why we feel very confident that the legislature will give us another year. Our hope is at DCY that they'll give us another year and we can then start circling back. I mean, the interest that we've had from the chambers has just been so strong, but I think everybody's kind of hesitant, because of that. If we know that we've got another year and being able to set up, we'd like to be able to go back to the legislature and say, hey, we think that a continued investment of $10 million a year would provide support to X thousand number of kids, and be able to see that continued type of commitment. And I think that that is what we would see if we had the full now year and a half, or 2 year period to really get this thing up and running. A lot of employers just ask, give me some models, give me some stuff. We want to develop those models because every type of employer is going to have different needs.
Can an employer contract with an Ohio child care network, for example, We Care, in this program?
Yes. Yes. In fact, that's probably a good way of doing it. As long as they are licensed facilities or utilize licensed facilities, that's fine. But that would help the employer and the employee saying, hey, here's a possibility of networks. And the employer can set it up saying, hey, we're doing this in conjunction with this entity. If you like them, that's fine. We're not going to pay other for some, but we're willing to provide child care, and that child care is available at X. The employers would be able to do that if they'd like.
Great.
Joel, quick question for you again, Steve Millard here.
Steve?
So I noticed it says here the employee is chosen by their employer to participate. Is there any sort of guidelines for the employer to ensure that they don't have liability for picking some employees versus other employees? Do you have to apply sort of a similar standard across any employee that sort of fits here is eligible if any one employee is given to it? Or could this be used selectively as an incentive to sort of keep certain employee who might be having some difficulty with child care and might be affecting job performance? Just what kind of range of, I don't know, judgment can employers make on this?
Yep. No, that's a great question, Steve. It is completely set up right now to be at the discretion of the employer. So those are things you would very much want to take into consideration if you're going to offer it. What is the right? If you're not going to have it open to all your employees, you would want to specify who you're choosing and why you're choosing that various group. And obviously, if you have a union, you'd want to be dealing with them, as well, to make sure, that you were doing it in line, with those requirements. But
so the program doesn't offer any sort of like exclusion from liability for me or anything like that. You're not giving us any protection if somebody decides to sue us because we don't offer it to everybody or something like that.
Yeah, no, great question. No,
okay.
No, nothing. No.
And then one other question for you. Do all child care providers that are licensed in the state have to accept this? I mean, I can imagine there's some private employers, for example, private providers that may not currently be dealing with the government. Okay. So they have to be willing to accept it. Okay.
Yes.
Okay.
Yeah. So they could be a licensed facility. It's just saying, I'm not going to do it because their billing is different.
Yeah.
And the employer could even identify the amount. So the statute is set up to be a 40-40-20 split. So you could limit your liability saying, hey, we're willing to pay $200, a month towards your child care. They would be required the employer would be, or the employee would have to pay at least that $200, and the state would be on the hook for $100 of it. Or they could say, hey, whatever it costs for childcare at that particular facility. And again, if it's $1,000, then you would split it there. So,
so the 40-40-20 is sort of the mix of the funding. It's not necessarily going to equal the total cost of the child care then.
That's correct. And the child care provider would bill you for that. So you would set it up with them. That would be part of the agreement. And they would be responsible for doing the billing, not the employer. So you wouldn't have to collect the fee from the employee. You wouldn't have to do a wage, redirect or anything like that. You would have the child care facility set that up.
So they bill us, they bill the employee, and they bill the state, and we don't have to get involved in the billing process as the employer.
That's correct.
Okay. Thank you.
Yeah, no, thank you. Good questions.
Great. Well, any other questions from folks on the call?
I don't have a question. This is Liz. But I did put in there our website, and Jill, we actually just updated it again today. If you even want to take it down, we are now at 75 families and 109
Fantastic.
children served. And we also have testimonials on there from both the businesses as well as parents, as well as the child care centers, and information if you want to see it. And then if anyone has questions, obviously not for this call, but if you want to, reach out to me, I'm more than welcome to help.
Liz, you're very kind, and I'm telling you, the work that you're doing is phenomenal. She had sent actually several examples of businesses that have utilized this program, and really helping to pave the way to convince the legislature that further investments needed in this area. You're really doing great work.
Thank you, Joel. I appreciate it.
That's great. Thank you, Liz. Well, if there's nothing else, we will follow up with another copy of these slides, a recording of the discussion, some contact information and helpful links. But Joel, again, thank you for spending some time with us today and being willing to do this. I'm sure you'll hear from us again, and look forward to continuing the conversation.
Sounds good. Thank you very much. Appreciate everything. Appreciate all your time, folks.
Absolutely. Thank you.
Thank you.
Thank you.
Thank you.
Good afternoon.